Today, I think what we can talk about is one of those three dangerous diseases. We have very many, but let's briefly talk about the three. Number one, I think we can talk about hypertension. Though many of you outside there know heart attack the most. You know heart attack? And some people asked me about diabetes, but I always talk about diabetes when I'm explaining and talking about circulatory diseases. Today let's talk about the disease called hypertension. With hypertension, and the patients out there suffering from hypertension, you have ever been told that your blood pressure is high. When they say that you have high blood pressure, I am telling you, people who always say that blood pressure is a disease, blood pressure is not a disease. Blood pressure becomes abnormal when it goes high. Actually, I may say that the abnormal increase and decrease of blood pressure causes harm to the human heart. But the word blood pressure isn't a problem itself. The word blood pressure isn't a problem. The problem is low blood pressure and high blood pressure. That's the problem. That's where the problem is. So, with the blood pressure, you are likely to have hypertension. Yes, you are likely to have hypertension. And don't forget that also low blood pressure will affect you. But let's first talk about hypertension. Hypertension, as we have talked about these vessels, primarily, we have talked about these vessels. Hypertension, it is when these vessels which transport blood to the human heart will be blocked by the abnormal accumulation of fats. Abnormal accumulation of fats. When the fats consumed by you through the food you eat every day or on a daily basis, the accumulation of fats in the vessels or in the arteries which transport blood will cause hypertension. And once the arteries which transport blood are blocked by the fats, the blood flow will be high. That's what we call high blood pressure. Blood will use high pressure for it to go out through the artery. In the artery or in the vein, you can see we have a lumen or the passage. It is like this. It is like this. The lumen or the passage. Let's use that word, that English statement. The passage, the blood passage. So the highest accumulation of blood in the artery will make this artery to contract. Actually, not that, but it will become narrow. It will become narrow. It will grow thin. It will be small in size. So the amount of blood needed to go through the artery will be reduced. So since blood needs to go through the artery, we'll need a high pressure for it to pump itself, and it goes through the artery. That's what we call high blood pressure. It is when your blood is fighting hard to go through the artery which has got fats in it. That is it. Now, hypertension will be caused due to high blood pressure. So that's why I would say that the moment your doctor tells you that you have blood pressure, please, ladies and gentlemen, seek for medical attention. Go and consult your doctor if you have a family doctor, and if you don't have a family doctor, go to the nearest health facility. Yes, go to the nearest health facility and get medical advice from the doctor, from the clinic officer, from the cardiologist, from any person. If you have your friend who is a medical doctor, talk to him or talk to her. Seek for medical attention. It is better to go to the nearest health facility, as long as you check and see that you have abnormal heartbeat. Because when we talk about abnormal heartbeats, there we are talking, because the normal heartbeat, a normal person, an adult person, or what we can call the normal heartbeats in a normal person, is the heart will pump 72 times per 60 seconds. I don't know whether we are trying to get that. The heartbeat in a normal person, in a normal adult person, the heart will pump 72 times per 60 seconds. That is 72 times per minute. What am I trying to mean? I'm meaning that the human heartbeat is 12 seconds faster than a minute. That's what I'm trying to say. The human heart beat are 12 seconds faster than a minute. So the moment you measure, now people have got very many equipments at home. People have got sphygmomanometers at their homes. So when you try to check and see that your blood pressure has gone high, please go and seek for medical attention. Ladies and gentlemen, let me say that it's our time now to sit and relax and ask ourselves what we should do. And next time, we shall be talking about that hypertension in a full capacity. We shall explain it much more. We shall talk about the heart attack, and we shall talk about the coronary artery diseases in full explanations. I thank you so very much. My name is Professor Jack Bell. Keep following us. You like our YouTube channel, you comment if you have a question there, or you have an advice, anything that you want to share with us. You can also share with your friends, because they all want to know this. So I thank you so very much, and I wish you good luck. Thank you.